Welcome to another episode of Mindful City, Tuning into Life, a podcast that brings you an intimate exploration of the businesses, practitioners, and artists making an impact in our community. Join us on Patreon for an exploration of all the people, places, and things that raise consciousness in our community by telling us about the businesses and happenings you'd like to know more about, and we'll explore them for you. Welcome to another episode of Mindful City, Tuning into Life. This is Helen Hall, and today I have a very special guest with us, Dr. Shyam, Vaidya Shyam, as we'd like to say in the world of Ayurveda. And Dr. Shyam is currently a medical director of Dr. Shyam's Ayurveda Center with branches in Dubai and Ajman. Also the managing director of Back to Roots Kerala, India, and the managing director of Natura Wellbeing in the UAE. When I asked him about the bio, he just told me to let you know that he's a practitioner of Ayurveda. I couldn't help it, especially because I just recently went through my study of Ayurveda, and I know that I've only scratched the surface of what there is to learn about Ayurveda. And so when I came across Dr. Shyam via Instagram, I knew what it takes for him to be in the position that he's in, the responsibility that he carries, and what he shared, and how he has a passion for bringing Ayurveda to an understanding for all of us that have maybe not been, have grown up with the culture, or are finding that perhaps Western medicine isn't able to provide us the things that we're looking for in this day and age. And so I wanted to welcome Dr. Shyam to the show today. Welcome, Dr. Shyam.
Thank you very much. I have been studying Ayurveda for the last around 28 years, but I still feel, I'm still a student. It's a big ocean.
Absolutely. And I think for myself, as more as I am learning, I'm thinking, as more I didn't know, So I just keep finding out. And actually, the reason I contacted Dr. Shyam recently is because of a post that he placed that someone had asked him a question about why Ayurveda takes so long to work. And his response really touched my heart, because I think that is why there is such a difference in the approach of Western medicine versus Ayurvedic medicine. And so I asked Dr. Shyam if we can address that topic a little bit today. Of course, I'm sure that we probably need a little bit of an introduction of how Ayurveda sees disease and the approach of disease. Would you share a little bit about how we go about that?
See, I'm sure that, and the listeners, will know a little bit about the concept of doshas and the dhadus, about the Vata Pitta Kapha. Hope at least, you are familiar with the concept of Vata Pitta Kapha.
I'm a little bit familiar, but I'd be happy if you wanted to just briefly share about the doshas, because I know it's important as you address disease, and I just want to make sure all the listeners are also aware.
Right. The entire concept of Ayurveda revolves around this concept of three energy factors, namely Vata, Pitta, and Kapha, which govern the entire physiology of the human body. Out of this, the energy factor Vata, it governs all the movements in the body. For example, right now I speak because of Vata. You blink your eyes because of Vata. Your lungs breathe because of Vata. Heart pump because of Vata. Muscles move because of Vata. Bowels move because of Vata. So you name any movement in the body. Let it be a minute movement inside a cell or a movement like speaking. It's all governed by Vata and their subdivisions. So according to Ayurveda, if this energy factor Vata is working properly, all your movements are pain-free, unrestricted, and in balance. The second energy factor, which is called Pitta, which is a fire-dominated energy factor, it governs all the transformations in the body. For example, food getting digested inside the mouth by the salivary enzymes, or food getting digested inside the stomach by the gastric secretions, or right now a sound signal is getting converted to a nerve signal. So let it be an enzymatic change, a hormonal change, a chemical change, or an inflammatory change. It's all governed by pitta and their subdivisions. So if this pitta is working properly, all the transformations in the body is healthy. So classical signs and symptoms of pitta imbalance is usually burning, bleeding, redness, etc. So when you see, a redness in the body, an Ayurvedic doctor will say a pitta is imbalanced there. Or when they see, a bleeding condition in the body, an Ayurvedic doctor will say pitta is imbalanced. So the third one, kapha, which is a earth and water dominated energy factor, it governs functions like growth, lubrication, some of the immune functions at the core level. These are done by kapha. So classical signs and symptoms of kapha imbalance is like itching, overweight, or a condition like diabetes, we call it as a kapha problem. So this vata pitta kapha, they work together to do the entire physiology of the human body. You take, for example, look at the process of eating food. Chewing, it's a movement which is done by vata. Digestion by the saliva inside the mouth is done by pitta. Lubrication of the food is done by kapha. Swallowing is vata. Movement of the stomach is vata. Digestion by the gastric enzyme inside the stomach is pitta. Protection of the stomach lining, regeneration of the mucous membrane, it is done by kapha. So the same way, the entire physiology of the human body, it can be explained based on the concept of vata, pitta, and kapha. So if this vata, pitta, kapha, if they are working properly in balance, so the entire physiology will be healthy. When one or more of them are imbalanced, it creates, disturbance in the physiology, which is called pathology, and the disease process originates from there. So that is the concept of vata, pitta, kapha in a nutshell.
That's really a beautiful explanation. And because even for myself, I love that you're sharing that in the way that you are, because I honestly didn't even see it in that exact way. So thank you for that. Because in Western physiology, basically, we don't have a particular aspect that we look at that says if all this is functioning properly, we say that the person is healthy. The only thing I can think of is if the heart's beating and the blood streaming and the person is breathing, they're alive, but I don't know if there are direct markers in Western physiology that we could say if these are not working together, we would begin to see disease. Do you see that, or do you have some way of correlating the two, or is this how Ayurveda is different?
See, for example, if I'm referring to a book in Ayurveda named Madhava Nidana, which is written in around 800 AD, it's a diagnostic classic. It provides, over 5,000 signs and symptoms. So if it is in the modern medicine, there may be 5,000 pills, for every symptom and every sign, right? Yes. So in Ayurveda, see, the Ayurveda looks at the root cause of the disease by analyzing all these signs and symptoms. For example, when you walk into maybe a Western doctor's office for a condition like headache, the doctor, the moment, here, you have a headache, will give you a prescription. But whereas, an Ayurvedic practitioner, will take your detailed history. It might take, sometimes, an hour to understand, the root cause of a headache process sometimes. So they try to identify the root cause and work on eliminating them. For example, sometimes, a digestive issue may be the cause of that headache sometimes. So an Ayurvedic doctor, might address on the digestion first, which will take care of your headache. So that is why the etiology and the diagnosis, it play a huge role in an Ayurvedic consultation. And in addition to that, Ayurveda take care of the patient also. Ayurveda do not treat, just the disease. So Ayurveda treat the person who carries that disease. So Ayurveda looks at the disease and the patient individually and collectively, and provide a tailored treatment plan accordingly.
Is the aspect of that because if when you're addressing the root cause that there's going to be a reoccurrence of the same issue, is that kind of the mindset then in the approach of Ayurveda?
Yes, in Ayurveda, as I mentioned, previously, one essential component of causing a disease is the imbalance of the Vata, Pitta, or Kapha, or the imbalance in the physiology. But now there is another factor, which is very important in causing a disease process, which is the impairment or the weakness at the tissue levels. For example, an imbalance of Vata manifested on a knee joint might cause an osteoarthritis condition. But the same way, an imbalance of Vata in the digestive system might cause a condition like irritable bowel syndrome. So you might surprise, why it located in my knee instead of locating in my digestive system. You might have a weak quality of the knee by genetic predisposition or by lifestyle factors. So it is easy for that imbalance of Vata to locate in your knee and to produce the health condition. So here, an Ayurvedic doctor, will look at two aspects now. One is to balance the physiology by balancing Vata, Pitta, or Kapha. And secondly, to improve the quality of that knee structure so that the chances of reoccurrence of a Vata disease in the knee will be lesser. So now there are two phases. One is correcting the physiology, and secondly, to improve the quality of the body structure.
I see. So that's why also, based on the question that somebody was asking you, that is kind of the process of determining the diagnosis process is longer in that sense, because you have to determine the root cause plus the weakness, and then begin with restoring the balance and repairing, or repairing for non-reoccurrence of a particular issue. It's interesting because prior to us starting the interview, you briefly asked me about if I knew about the stages of disease when I went through my own Ayurveda lesson. And I'm really curious to hear your perspective and why that is so different in the way that the diagnosis and care is prepared here in the Ayurvedic sense versus the allopathic sense.
Right. See, in Ayurveda, we give a lot of importance, for understanding the signs and symptoms of a disease condition. At the same time, to understand that patient. And but as I mentioned, we analyze these symptoms, to get into a conclusion on the treatments. So Ayurveda categorize, the symptoms and signs into different areas. One is called, the disease-specific symptoms. For example, a bronchitis will have a cough, as a disease-specific symptom. Now, there are other type of symptoms, which are called Dosha Lashanas, that is the symptoms, related to the imbalance of a dosha. And there is a third type of symptoms, this is the stage-wise symptoms. So it may not be, the symptoms, which is observed, all the time. The symptoms of a disease will change according to the progress or the retrogress of that disease. And certain symptoms may appear, or certain symptoms may disappear also during a disease process. Now there is another type of symptoms which is experienced, by the patient only. The patient, will come and tell you that, I have a pain, which is felt only by the patient. Now, there are certain other symptoms and signs which is recognized only by the physician. See, the patient, might not be feeling that, he is facing an issue, but the physician will be observing it. So now the symptoms are of different categories, according to Ayurveda. Some are disease-specific symptoms, some are dosha-specific symptoms, some are stage-wise symptoms, some are subjective symptoms, some are objective symptoms. See, here again, the six stages of the disease, that is coming, in this context now. Now, according to Ayurveda, the imbalance of the doshas, it transits through, different stages. In the stage one, Ayurveda say, it is called the stage of accumulation or the stage of increased level. So this is the stage at which, you might see some of the premonitory symptoms. For example, interestingly, you take a condition like a jwara or a fever or a febrile condition. A patient, might feel likeness and fondness for sour and salty taste, and a person might start disliking sweet taste. So here an intelligent physician will say that it may be the stage of accumulation or, the premonitory symptom of a fever condition, and might start, some remedies at that stage itself. So the second stage, as per Ayurveda, it is the stage of excitation. So the accumulated doshas, it get excited and accumulating in excess. And in the third stage, it is a stage of spread. So the doshas, excited, accumulated, and it spreads to the other part of the body, the organs, systems, leaving their original sites of accumulation. And in the fourth stage, it is...
So, and you're referring to all, I just wanted to ask you about the third stage briefly. So when you're referring to Vata, Pitta, Kapha, you're referring in their physical form. And I just wanted to clarify that they normally, just as you were saying, Vata is regulating particular areas in the body. And I just wanted to know if you could give an example of where they would be spreading and how that would look.
Right. See, Ayurveda gives, there are certain specific seeds, for Vata, Pitta, and Kapha. According to Ayurveda, the area below the navel, it is considered as the seat of Vata. And the area between the navel and the heart is considered as the seat of Pitta. And the area above the heart is considered as the seat of Kapha, generally. But for example, if I talk specifically, the eyes are the seat of Pitta. The stomach is the seat of Kapha also. So you might think, how the seats, vary. See, Ayurveda gives a beautiful example. Say, for example, on the road, like 100 people are walking through the road. Out of them, 95 people are holding an umbrella. So we might say a group holding umbrella is walking through the streets. Actually, it's only 95 who are holding the umbrella. 5 are not holding the umbrella. So this reference is based on that, the seat of the disease. So now, for example, you take a condition like headache or a migraine condition, which is caused by a Vata Pitta imbalance. But head is not the seat of Vata and Pitta. So it has moved from its original seat, which is in the lower part of the body, and it has moved to the head region and producing the health condition. So I will say, a migraine condition as like a Vata Pitta imbalance, which has occurred in a Kapha seat. And now in the next stage, the stage of localization happens. The doshas, enter into the individual cells or the tissues or the organ and cause the disease process. And then to the stage of manifestation also, where, the clinical symptoms and signs of the patient become more apparent in nature. And there is the sixth stage, at which, the complications are seen, where the disease becoming chronic in nature. And sometimes, permanent pathological changes of incurability are established in this stage. So,
it's actually hopeful to hear that there are stages to disease, because that in a way through Ayurveda gives us an opportunity to identify things prior to them going into this final stage, which could be an irreparable stage, at some point in time.
Actually, this is the definition of a physician itself. A best physician is one who can diagnose a condition at the premonitory symptoms itself and do the remedial measures.
Mm-hmm.
He or she should not, wait for the disease manifestation and then to treat.
Exactly.
Right.
But that's usually when people go to the doctor. It's at that last stage, at that point where it's really starting to affect their life in such a way that they don't know what else to do.
Right.
So how do you approach that as a physician?
Right. See, but for it's easy for a common person to understand, some of the symptoms of the vitiated or the imbalanced doshas. For example, as I mentioned earlier, pain. That without vata there is no pain. So in all the pains, vata is the imbalanced dosha. You take a symptom like burning, pitta is the imbalanced dosha. You take a condition like itching, kapha is the imbalanced dosha. So these are, some of the symptoms, which gives you an idea about the imbalanced dosha. Now, for example, there are certain symptoms, which are related with the symptoms of a disease. You take, a pulling pain on the leg, which is starting from the low back and which is radiating to the leg. So it is a condition named sciatica, which you call in modern medicine. In Ayurveda, we call it as a condition named gridrasi. Now, imagine that, a patient is coming to you with a cough with expectoration. That is a cough with mucus secretions. So it indicates that Ayurveda doctor will say it is a kapha-dominated cough because of the expectoration.
Right. Because of the mucus and
the mucus. If it was a dry cough, an Ayurvedic doctor might have said it is a vata type of a cough. So here, it gives you another idea, for the Ayurvedic doctor. It indicates that the patient might have indulged in a kapha increasing food and which caused the disease. So the doctor, will ask the patient to avoid the kapha increasing food. So the doctor will ask him
dairy, things like that.
Correct. Dairy things, yogurt, cold food, etc.
Right.
While, if it was in the case of, a dry cough, the doctor, might have given, something more of a sweetish kind of medicines instead of giving a spicy kind of medicines.
Right.
So in Ayurveda, the medicines are totally different, depending on whether it is a vata cough or a pitta cough or a kapha cough. But here all, it is the signs and symptoms, which gives, an idea about the condition.
Yes. And that can be so different for different people, right? Because, if you go in Western medicine, it's just a cough. That's it. It's not particularly looked in the way of the constitution or doshically based on the elemental constitution of a person. Yeah.
Correct. See, the modern medicine is driven by, a structure or a part. But Ayurveda gives, more importance to the function or the effect of a whole, the whole person. See, so the signs and symptoms, it constitutes the basis for the diagnosis as well as the medical management in Ayurveda. So it is not, in modern medicine also, it's very important, to understand the signs and symptoms.
Of course. Yes.
But in Ayurveda, the only thing is that the signs and symptom or a structural knowledge, it is judiciously integrated and interpreted in the Ayurvedic paradigm of the whole person.
I see. But in Ayurveda, is there a part in the stages of disease where Ayurveda says we're not able to turn back the clock? on a particular disease, like in terms of chronic? Is there that determination, or what has been your experience?
Right. See, surely, at the stage of Bheda, that is the sixth stage of the disease, there is, which is called, the disease is turning into a chronic nature. At this stage, the doshas will, get deeper into the body tissues, and it results in permanent pathological changes of incurability. So at this stage, it might be difficult, for a physician to treat that condition. So condition, we call it like chronic or incurable or difficult to cure.
Mm-hmm.
Here, Ayurveda suggests, another mode of approach also. See, once the disease, turn into a chronic stage, dosha balancing alone is not enough. At this stage, Ayurveda suggests rasayana. Ayurveda suggests the science of tonics, the science of targeted nutrition for treating a chronic disease condition.
Okay, could you expand on that a little more?
Right. For example, you take a severe osteoarthritis or an osteoporosis or an osteopenia of a joint. So here, an Ayurvedic doctor will surely suggest, some vata balancing herbs, but at the same time, he or she might suggest, some rasayanas. For example, you take sesame seeds. An Ayurvedic doctor will say, you should take a teaspoon or 2 teaspoons of sesame seeds on a daily basis. Mm-hmm. This is primarily because of the rasayana effect or the targeted nutrition effect of that particular sesame seeds. Mm-hmm. So at this stage, because
for the joints and, like nourishing and correct. Toning, is that what? Yeah. Mm-hmm. Okay. Correct.
So when you look at the type of rasayanas also, the type of tonics also, there are different, again, sorts of rasayanas. For example, some of the rasayanas, they directly enrich the body tissues. For example, you take herbs like asparagus, you take milk or ghee, they directly nourish the body tissues. Now, there are certain other herbs, which improve the nutrition by improving the digestion and metabolism. Mm-hmm. Certain other herbs, they might promote the competency of the microcirculatory channels in the body, leading to the better bioavailability of the nutrients or, improved tissue perfusion. So there are different, modes of action of this tonics. So the mode of action of a herb like asparagus will be different from the mode of action of a herb like gugulu. Mm-hmm. Or the mode of action of a herb like garlic will be different than that of a asparagus.
Mm-hmm. Yeah. So in that way, there is that approach of bringing back the doshas to balance or working on that balance, and simultaneously working on rejuvenating, tonifying, or giving nutrition to those areas where there's already been pathological changes, as you would say.
Exactly.
Correct?
Exactly.
Mm-hmm.
See.
Okay. So, it's interesting because that was, really the question that someone had posed to you on Instagram was this idea of why does it take longer, because I think we're so used to, taking a pill for the symptom, and, you have a headache and you take a pill and that's for the headache. And so we don't understand the time that it may take, to get to that. And has that been your experience, and how you educate and work with your patients and the people that you see and educate about Ayurveda?
See, Ayurveda has, several, fast-acting medicines also. But these kinds of medicines, they are mostly the herbo-mineral compounds. So herbs, together with certain mineral compositions. But, they give, quick symptomatic relief. But an Ayurvedic doctor might not give such medicines for more than 1 or 2 days. Because the whole concept of, treatment is to work on the root cause of the disease. So An Ayurvedic doctor, will primarily look at, correcting the root cause rather than just the symptomatic reliefs. But for example, you take a condition like, severe fever. An Ayurvedic doctor, might treat for the root cause of the fever, but at the same time may give, a pill for, maybe one day to correct that symptom, or to pacify that symptom just for a while.
Right. Yes.
And we also need to understand that, the majority of the present day ailments are all, chronic in nature. So like you take, diabetes, or you take psoriasis, or you take asthma, or you take hypertension or irritable bowel syndrome, they're all chronic in nature. See, such chronic diseases, it's a challenge for any medical system. Any medical system will take, will take time to heal. And
or give some symptomatic, or give some symptomatic solution just to maintain or to make people survive okay, with that chronic illness. So
correct.
Yeah.
And we get, another group of patients, who comes to us, after being discarded by the modern medicine.
Yeah.
At the terminal stage, we'll say that, that my modern doctor said, we cannot do anything further. You go home now. Right?
So you get the more difficult cases, basically.
But actually, the Ayurveda should go to the primary care level rather than, becoming a secondary care or as a tertiary care model. Because if treated at the primary stage, the disease will not get into the next stages of manifestation or chronicity.
Yeah. So in that, primary care stage, there's also with regular visits and conversations, those things can be either monitored or the person is starting to know how to identify when that is becoming an issue and can then approach, Ayurveda doctor practitioner to begin to look at that and treat them at those stages.
See, some change in the approach is also required from the Ayurvedic doctors, rather than, sitting in the consultation room and, waiting for the patient wearing the jacket and stethoscope. You should go to the patient.
Yes.
See, in my village, I used to say, we had an Ayurvedic Vaidya. He was a member of the family for, all the nearby household villages.
Yeah.
So the villagers, had, so much of faith and trust on that Vaidya. So even if, there is a specialist in the neighborhood, the villagers, will go to this Vaidya, will ask him, is it okay to go to that specialist?
Right. That's so true. It's, it almost makes me feel that it would be lovely to be back in this village mode. I was, talking to someone the other day and saying this village mentality where we're so much closer to each other and observing each other, because in that mentality, you'd notice, within family, within a village, you notice more what's happening and you can be there and be supportive of each other more. Instead of that we're so spread out that we're not noticing each other as much. So that's the approach that you're sharing.
Such model is possible in the metro cities also. Such model is possible in the metro cities also, because I insist, my junior doctors, after a consultation, you call the patient, after a week time and inquire, how do they feel? Yes. Imagine, we go to an allopathic clinic and, getting a call, after 1 week, how do you feel?
We might not believe it.
Correct. Exactly. This is where, the medical care is getting into the primary care level and, getting connected with the patients.
I'm so inspired by you and really touched by so much of what you're sharing. And I'll be sharing with all the listeners the information that you have on your website, many articles that you've written and videos that are there, so that we can all become more familiar and educate ourselves so that we can see how Ayurveda could be of such a holistic benefit in our life, because it touches so many different levels of our being. And if we can be healthy on all those levels and find that way to stay balanced. So I'm so appreciative for you taking the time to come on the show. I really hope that this is not your only time that you will come. I think there's so much more that we can learn from you, and I would love to have you back on the show again in the future.
Thank you, Helen. I know that, you promote and propagate, Ayurveda, and you practice Ayurveda, right?
Yes, absolutely.
Wonderful. Right.
Yeah,
Nice.
it's changed my life, Dr. Shyam. It really has. And so I think you just can't help but have to share.
Thank you so much. And
Yes.
for the listeners, please share my Instagram also. So Dr. Shyam Ayurveda. Nowadays, these are good medias, to communicate.
Exactly. Thank you so much for joining us today.
Thank you, Helen. Thank you so much.
To find out more about Ayurveda and connect with Dr. Shyam, join his Instagram community at Dr. Shyam Ayurveda, DRSHYAM Ayurveda, or vaidyasham.com.